Ardi, earlier on you mentioned the complications of poorly controlled. We have to emphasize that complications of poorly controlled type 1 diabetes, because we keep hearing no one ever, differentiates between a well-controlled type 1 sort of diabetes and, poorly controlled, but differences are huge. So let's talk about some of the complications that you're aware of badly or poorly controlled type 1 diabetes, especially if you're running your blood sugars constantly at levels above 7 or at 10. In fact, a small anecdote: the other day I woke up really feeling like hot and uncomfortable and sweaty in the middle of the night. My alarm didn't ring. I wear a CGM. My alarm didn't ring, and my blood sugar was 10, which is 180. That was not normal. My body, that's just so not normal for my body. And I had a pod. I wear the Omnipod. I had the cannula or something, so I had a pump failure. But at that level, because I'm so accustomed to normal levels or lower levels. At that level, I felt uncomfortable. It actually woke me up, not the alarm, but feeling uncomfortable and sick at 10. And yet they tell people, oh, as long as you're, sort of hovering at 10 or 180, you're fine.
Yeah.
No.
Yeah. The parents of, I think the parent, that's the first complication is that you feel like crap when you're high. And the parents of type 1 kids, they're not told this. So they want their kids to go out and just not even have the condition. And their way of doing that is to pretend the kids don't have the condition and then feed them birthday cake. And they look at the CGM and it's up 200 and then 300. And they say to themselves, well, we'll bring it down in a few hours, but let them be kids for now. But the parents have no idea what that feels like, and the kids are either used to it or they're not able. If you have a 2-year-old, they're not able to verbalize how terrible they feel, and after a while, terrible is the baseline, and that's the first complication. And then the next reaction amongst many of the parents is that, well, I'm going to let my kid, figure out how to eat on their own when they're older. But for now, I'm going to let them eat all the obesogenic processed food that all the other kids are eating, so that they can live a normal life. They call that normal, to overwhelm their children with junk food and run their blood glucose sky high. And the problem with that is not just that you feel terrible, but that the complications of diabetes come on a lot faster than what you're told. You say, the typical pushback to that is, well, my doctor said there's no problems and that the A1C is good. And that's like, you're accepting that free pass without really thinking about your child, because why are you assuming that you and your doctor have the same interests for your child? So what kind of complications can the kids run into? Well, when Dave was diagnosed, there was the beginning of an avalanche of literature on damage to the developing type 1 child brain. And you can see in the MRI studies of type 1 children that there's differentiation between the percentages of gray and white matter amongst kids who are running high blood sugars all the time. So right there's evidence that there's damage to the developing brain, right? There's morphological damage going on. And then there's a lot of other studies too. There's things like cardiac autonomopathy and there's a whole host of, so there's about 100 different diabetic complications, let's say, and your endocrinologist is not doing an exhaustive 8-hour exam on your child when he comes in to test for these complications. So if you think that you don't have complications or your kid doesn't have complications because your endo said so, they're not really doing the tests required. And a proper physical exam would last a full day. So, why would you roll the dice and just pretend that the problems aren't going to occur? Now, what about later in life? Well, later in life, we know that if you continue to run these blood sugars, you're going to have a shortened lifespan. And you say, well, it's worth it to me to, cut a few years off so that I can eat the grocery store cake and all the goodies. But you don't just get a couple years cut off. You start developing big problems. So the little problems when you're a teen become big problems in your 20s and 30s. And what kind of problems are those? I'll tell you about one problem. And you can read about these in the parents, not in the parents groups, in the type 1 groups. So if you're a parent of a young kid, I suggest you go into one of the adult groups and search for the word gastroparesis. Gastroparesis is a neuropathy of the vagus nerve. It stops you from being able to properly digest your food. A severe case of gastroparesis. So, and by the way, gastroparesis is not uncommon in type 1 children. So this is not something that you're just going to sit back and find out about 20 years from now, and maybe there'll be a cure by then. No, it comes on right away. And then as you get older, you're gonna vomit when you eat. You're gonna puke up blood. Your life is going to become miserable, and every time you eat food, you're going to be in a significant state of agony. Read the accounts of people who have this condition, and it's not an uncommon condition.
It's so common that Dr. Bernstein has a whole chapter on gastroparesis in his book. He discusses it extensively.
That's right. There's a video on gastroparesis diabetes at Diabetes University. And again, we run into problems where the gastroparesis is misdiagnosed, improperly diagnosed, and is improperly treated. So he goes through all the the ways that you can. So not only does he tell you how to avoid the complications, how to reverse the complications, he's also teaching you how to treat the complications, because for one thing, he worked in a diabetes wound clinic for, I think that was his pro bono work. He worked in a wound clinic on, I think, Saturdays for decades, training with one of the best diabetes wound doctors that the world had known up to that point. And, when you sit back and you listen to Dr. Bernstein's stories about what happens to people, it will, if you respond to that, and why wouldn't you? Wisdom is learning from the mistakes of others. Why wouldn't you say, hey, I'm not going to let this happen to me, rather than I don't want to hear those things. The doctor said it's okay. So there's a weird reaction.